Hey, Dr. Van Dyke back here for part 2 of diabetes education. So let's get started. All right, part 2, monitoring and self-management. First off, question, true or false? Having diabetes puts you at a higher risk for having a heart attack, stroke, kidney disease, nerve damage, blindness, amputations, and sexual problems. False. Like we just said at the end of part 1, it's when we get ahead of these things early and aggressively that you do not suffer the life of diabetes like previous generations have. So it's false. Having unmanaged, uncontrolled diabetes puts you at higher risk for having a heart attack, stroke, kidney disease, nerve damage, blindness, amputations, and sexual problems. So how do we monitor? Glucometers, this is old school, right? These are going away because continuous glucose sensors are becoming really mainstream. So glucometers is the old school finger stick, right? Measures the amount of glucose that's in the blood, gives you a snapshot of what your blood sugar is doing right now so that you can make decisions about how to dose insulin, or it helps me make decisions when I see the patterns about what kind of medications should we be using. We don't test on the thumb or the first finger. Also, I like to test on the side of my finger so it's not on the pad and in my way all the time, but that's my personal preference. Other ways we can check glucose, we just talked about that a little bit, these continuous glucose sensors or monitors called CGMs for short. These are FDA approved. We might be able to use them in the hospital in the future, but nobody's tested that really yet. It's awesome because all these devices, you can send the data right to my clinic immediately. I can see that. Like, for example, I had a type 1 patient years ago. After he graduated college, he wanted to go hike on the Pacific Crest Trail for several months. And I was like, okay, no problem, but you need to wear your sensor, because if something happens and you end up in some little local hospital in the middle of nowhere, I need to be able to see what's going on. They need to be able to call me. I need to see the data so that I can make recommendations to help you. So I love these sensors, and you can't get away with anything. That sensor is always checking, right? Okay. The insurance coverage for these things is getting better and better, but overall, there's still expensive technology. Some of the devices are not yet FDA approved to stand alone, and they require a calibration finger stick. So usually that's once or twice a day, but that will also be going away. Factory calibrated devices are becoming the standard. But I try to get these really for any patient that I can get them for, because there's no reason not to use this technology to make your life simpler and make my life simpler. There are other ways to check glucose. There's urine testing, but this is not something that is standard of practice. It's really beyond the scope of this discussion. And there are ways you can test alternately, but the finger sticks on your digits and the CGM is what we do for standard. Why do we care about self-management? Well, because if you're a healthy eater, you get better control. Now, I always tell patients, listen, I got a closet full of drugs. I got a drug pretty much can target any underlying cause of your type 2 diabetes, and I got insulin like crazy. So I promise I can control your diabetes if you want to do nothing else but take the medications. But no medication is ever as effective or beneficial as what you are able to do for yourself. And that is why we nag patients constantly about having important lifestyle strategies. Okay, so healthy eating, that's the cornerstone of your lifestyle interventions, improves your metabolic control, reduces complications. You get other benefits. If you go from eating a garbage American diet to eating a Mediterranean diet, it's not just your diabetes is going to benefit, it's everything, okay? Everything. Self-management and diabetes education, that you're all watching this for, reduces hospital admissions and healthcare costs because you are empowered to care for self. And that's what really matters. You need to understand what this disease means. You need to understand the resources that are available to you and be able to make good decisions for yourself. So, diabetes comprehensive care, it's not just what you do, and it's not just what I do. It is a plan that involves an entire team. It's the patient, it's the patient's family, it's the dietitians, it's the doctor, it's the nurses, it's the educating team, it's even the pharmaceutical reps, because those are the people that get us the free samples, that get us the coupons so we can get you the best stuff for free or for low cost. And so it's a multidisciplinary approach. Now, self-management isn't just about the diet. That's one of the cornerstones. Physical activity is another thing. And in part one, we brought up the American Diabetes Association recommendations for A1C, blood sugars. Well, they also have recommendations for physical activity. And they want everybody to get 150 minutes per week. So that's 30 minutes 5 times a week at minimum, to improve their insulin resistance. They have also made updated recommendations for those of us that sit at desks all the time, that you're supposed to get up every 30 minutes and walk around for 2 or 3 minutes because, and this is a good example, it improves your insulin sensitivity. The mere act of sitting down and watching an entire movie all the way through without getting up to walk will impair your insulin sensitivity. All right, so physical activity, super big deal. Healthy eating, equally big deal. Medication taking. If you are on meds, you must take them as prescribed. Don't miss any doses, because if you come and see the doctor and you go and have labs done and you haven't had all the medication doses, we cannot possibly make appropriate decisions about what to do next, okay? And then everybody should have their own goals. Little goals, big goals, short-term goals, long-term goals, because it keeps you motivated, all right? Physical activity. Now, I always underscore to my patients, you do not have to be a marathoner, you do not have to be a triathlete, but it is important that we get both aerobic and strength exercises every week, okay? Here's the recommendation from the ADA that was October of 2016, 3 or more minutes of light activity every 30 minutes during any prolonged sedentary period. The goal is, this is your life. You get active, you stay active. And like I said, you don't have to be a marathoner. If you take a walk every evening, or I beg pardon, if you take a walk after your largest meal of the day for 20 minutes, 30 minutes around the block to the park, you will have an impact on your insulin sensitivity. Okay, start there. All of these recommendations, this is why we have this asterisk here, they all are individualized. Remember, we talked about the A1C in part one as being an individualized goal. Obviously, if you are 90 years old with a broken hip, I'm not going to expect you to go walk around the block for 30 minutes after your largest meal, okay? You have to modify these activities as appropriate for your condition and complications. Healthy eating. Meal planning. This can become very, very burdensome. But what I want patients to know is the diet that matters is the diet that makes sense in your life, okay? So A meal plan needs to fit into your schedule, and it needs to take into account what are your favorite foods. It needs to account for needing variety, because we would all go crazy if we ate the same thing every single day without fail. And it needs to take into consideration other medical problems that you have, okay? Because diabetes is not the center of the universe. There are meal planning tools available. Dietitians can teach you how to carbohydrate count. You can use the Rate Your Plate online. There is the glycemic index. Some packaged foods will say, how do they rank on the glycemic index? This has less reliability than carbohydrate counting. And so I'm a person who loves precision. And so I would opt for carb counting. But simply reading food labels, this is one of the most highly prized skills that you can develop for yourself. And one of the things I would like to do in my community is take people to the store and teach them about where do you get the stuff that's going to give you the best bang for your buck? How can you afford to eat healthy? And how do you read those dang labels? Now, watching portion sizes, that is so difficult in this country, because it's not just restaurants that serve large portions, although they do. You can feed a family on what some restaurants will serve. It's packaging too. Like you buy an individual bottle of soda and you think, oh, I'll drink this bottle of soda. That's one serving. No, typically it's 2 or 2.5. We will go through that a little bit later. But portion size and making sure that the choices for your diet are giving you highest quality nutrition is key, all right? And this comment kind of underscores what we're like as a society. Yes, I'd like that garden salad, some fresh fruit, a slice of tofu, carefully arranged to look like a cheeseburger, shake, and fries. I hear you, man. I do love the In-N-Out. Okay, meds, right? Best habits, take the meds as prescribed. If you're confused about your medication, discuss it with your pharmacist or with your doctor. Remember, some supplements can interfere with how you absorb your medications. So it's important that your doctor and your pharmacist are aware of what herbal supplements and vitamins and all that you take. Now, the reminders on the pill boxes, my God, I could not live my life if I didn't have my pill boxes that told me exactly what I'm taking, when I'm taking, and then it tells me if I remembered to take it that day too. Things that I want you to be aware of, that meds that are going to raise blood sugar, pseudoephedrine, this is a cold medication. This will raise blood pressure as well. Anytime you get steroids, whether these are pills or injections, and it's very common, people go in with a sore throat, they get strep, they have a problem with their joint, they get an injection, they get some prednisone, it makes them feel better, also makes blood sugar go nuts. Beta blockers can affect blood sugar. That's like metoprolol or carvedilol. Thiazide diuretics. These are like hydrochlorothiazide or chlorothalidone. These medications can affect your blood sugar. And then there are certain antipsychotics, clozapine, olanzapine, geodone. These things will cause high blood sugars. So diabetes management is real simple. Simple. S, don't smoke. I, inspect your feet daily. Inspect eyes yearly, and inspect teeth at least once a year, right? Your eyes and your teeth are the windows to your body's health. M, for monitor your blood glucose and A1C. P, lower your blood pressure to less than 140/90, as the ADA says. L, lose weight if needed. Why? Because it increases your insulin sensitivity. And when that happens, we need fewer meds. Exercise. Exercise most days of the week, at least 5 days of the week for 30 minutes or more. That's the ADA recommended minimum, amount of activity. If we were to get the cardiologists involved, their professional society says you need way more than that. They want 45 minutes to an hour every single day, okay? So the more you can grow to love physical activity, the better your life is going to be. Goal setting. You need goals that matter. Consider all your options. They need to be reasonable with your target. We cannot assume if you're going to walk into my office with an A1C of 12 that we're going to get you to an A1C of 6.5 in a month. It's not going to work, okay? So reasonable targets. Give yourself some time. It's okay to do something slowly when we're doing it right. We want to be specific about our goals. It's hard to meet goals if we're not very, very clear and precise. Breaking them down into steps is helpful and encouraging. And deadlines, right? Everybody says, oh, I love deadlines. I love them. I love the sound they make as they go whooshing by. We want deadlines because deadlines hold us accountable. And if we fail to meet a deadline, it's not the end of the world, but it's time to set a new one. It's okay to ask for assistance, to find a partner who's going to help you go through all this stuff. And we need to be able to have some foresight. You know, we're going to say, oh, I'm going to start eating the Mediterranean diet. Okay. But we need to know, what are the barriers to doing that? Well, think about, here's one. We live in Texas, okay? And Tex-Mex is our national pastime. It's real hard to eat the Mediterranean diet when there's a Tex-Mex restaurant that is delicious on every corner, okay? Anticipate your barriers, have plans for getting around them. You need to set SMART goals, right? Again, this is reiterating what we've already said. Specific, state exactly what you want to accomplish, who, what, where, why. We want it to be measurable. How are we going to demonstrate and evaluate the extent to which our goal has been met? It needs to be achievable. It's important to challenge ourselves, to stretch our capacity, but they need to be goals that are within an ability to achieve an outcome. So they need to also be relevant. How does that goal tie in to your life? Why does it matter to you? How is it aligned with your priorities in your life? Okay. And time bound, right? Setting deadlines, one or more target dates, these by when, all right? So I want to start eating the Mediterranean diet. Okay, great. Step one, this week, I'm going to read about the Mediterranean diet. Step two, next week, I'm going to go to the store and start looking around for the things that make sense to be a part of the Mediterranean diet. Step three, the following week, I'm going to experiment with, let's say, 2 recipes that week, and so on and so on. And eventually, when you subtly make these changes, they become part of your fabric of life, and then you don't even notice them anymore. Okay, so SMART. Here's an example. To help manage your diabetes, you need to spread carbs out more evenly throughout the day. So let's say our SMART goal will be, I will eat a breakfast that has 45 grams of carbohydrates every day for the next 2 weeks. It's specific because it targets breakfast. It's measurable because we're going for 45 grams. And it's attainable because we know from reading our resources and talking to our dietitian that can be 1 cup of cooked oatmeal with a half of a banana and a hard-boiled egg and black coffee, or it could be 2 scrambled eggs, 1 small whole wheat pita or piece of toast, 1 orange, 1 cup of 1% milk, 3 rye crisp breads, a half cup of non-fat cottage cheese, and 1 cup of blackberries. So it's attainable. We know that there are many ways that we can get to that goal. It's relevant because planning your life like this helps you curb hunger, so you're not going to overeat. And we've given a time frame, 2 weeks. Examples of other ways to set goals. What do I need to work on? What will I do to start working towards that goal? Here's when I will do it. Do I need anything to get ready for this? What are my barriers? Oh, this is a barrier. What can I do to get around that barrier? What if I can't get around that barrier? And then here's my start time. All right. Eating 4 days out of the week, I will eat half an apple instead of ice cream as my evening snack. Okay. An exercise goal. 5 days a week, I will take a 30-minute walk during my lunch hour. Okay. So once you've met your first couple of goals, boom, it's time to set more, right? It's time to challenge. And so that was the end of part 2. And I will conclude this here, and we will come back for part 3 for meal planning.